Thank you for joining this presentation on selecting a universal screener. My name is Catherine Doherty Kurtz. I'm a school psychologist by training, the project director of the Birch Project, and a postdoc with the Boston Public Schools Behavioral Health Department. Thank you to the Birch Project leadership, Dr. Sarah Whitcomb and Dr. Melissa Perot, for your leadership in the development of this module series on social, emotional, and behavioral, or SEB, screening. I want to introduce the Birch Project. The Birch Project is the Behavioral Health Integrated Resources for Children project. The mission is to provide professional development resources for schools and to strengthen the coordination of behavioral health supports across schools and community agencies. The Birch Project is led by faculty members from UMass Boston and UMass Amherst, and we're sponsored by Boston Children's Hospital. For more information, check out our website at umb.edu/birch. This introductory module is going to provide a brief introduction to universal SEB screening, including what it is, SEB screening within the current crisis of racism and inequity, and provide an overview of the remainder of the modules in this screening series. The purpose of these modules is to provide information about screening. We know, as with any systems effort, that implementation of universal screening is best supported by ongoing coaching and technical assistance, including learning from other schools and districts who've engaged in universal screening. The comprehensive behavioral health model of the Boston Public Schools, which is a collaboration among Boston Public Schools Behavioral Health, Boston Children's Hospital, and UMass Boston, has done some incredible pioneering work in universal SEB screening in a large urban system. We're incredibly grateful for their hard work in this area, and we encourage you to learn more about their screening efforts, including how they use screening to support prevention and intervention across the tiers, and how they use screening data to evaluate the effectiveness of their systems framework. You can check out their website at cbhmboston.com. SEB screening is a critical component of a multi-tiered systems of support framework, and the Birch team has really seen firsthand how invaluable it can be to guide intervention planning and database decision-making around students' behavioral health needs. It can help teams think about schools as a system, how to allocate resources, and how to prioritize where to begin making systems change. Many in the field refer to screening as a temperature check for how your population of students in your schools or districts are doing socially, emotionally, and behaviorally. Screening can help school professionals improve focus on universal instructional efforts and target individual students who may be in need of further intervention. It can help us identify areas of student strengths, what they're doing well, and areas of risk. So we are not only screening to target individual students that might need additional support, but to think about aggregate or overall forms of data that will help us understand our school population, so we can adjust our overall systems in the school building to feel safer, more supportive, more effective, and efficient for all. If we go back to the previous slide here, universal SEB screening is considered a tier 1 practice because we are screening all students with these goals of adjusting our systems and instructional practices, as well as to focus more targeted interventions for groups and individual students. We encourage you to check out Romer and colleagues' best practices in universal screening for social, emotional, and behavioral outcomes, an implementation guide for more information about best practices in universal SEB screening. We know that universal SEB in school settings can make screening more efficient and help build on existing resources. Many local districts are voluntarily doing universal SEB screening. This depends on the local school district, though. It can be confusing for schools and districts to understand current requirements for screening in Massachusetts. Here are some of the current requirements around screening. Physical health screening, such as vision and hearing, is required. Massachusetts requires verbal substance use health screening in public schools. SBIRT, or screening, brief intervention, and referral to treatment, is being used to meet this mandate. At this point, school districts are asked to select one middle school grade and one high school grade to screen based on local substance use behavior data. The Children's Behavioral Health Initiative, or CBHI, which is part of the Mass Health Office of Behavioral Health, requires that primary care providers screen for behavioral health conditions at pediatric well-child visits. There are 12 different approved screening tools primary care providers can utilize at this point. However, if children are not regularly being seen by a primary care provider, they will not be regularly screened in that setting. We're going to briefly stop here so you can think about what your screening practices are currently happening in your school, district, and community. Equity, as with all things we do, should be at the forefront of universal SEB planning, administration, and use. Throughout this module series, we will be addressing equity considerations and questions to ask throughout this screening process to make sure equity is at the forefront of decision-making. Because as this quote states, if interventions addressing disciplinary and management practices are framed within traditional institutional structures and perspectives that have historically advantaged students from the majority culture, it is possible they will only be effective with white students. Fields of psychology and behavioral health and medicine have a history of assessment practices that have over-identified individuals from disadvantaged backgrounds or underserved populations in a deficit model, or as being discrepant in some way compared to samples of white individuals. Without equity and access considerations, universal SEB risks perpetuating these racist assessment practices. As we will discuss throughout this series, ongoing examination of universal SEB practices is critical, so screening is not perpetuating inequitable systems. Processes like collaborative inquiry can help inform our examination of screening practices as we plan and implement universal SEB screening, such as who is on our Tier 1 team? Do we have community voice? Who are we considering experts at the table? What are the backgrounds of the staff we're asking to complete screening? And how does this compare to our student population? The purpose and goals of screening, how data is used, including how we are using screening data to dismantle inequitable and ineffective systems, such as are we disaggregating screening data to look at results from students from marginalized groups, and then using those results to plan system intervention efforts and adjustments to our instruction and supports. This kind of thoughtful approach to screening will, of course, require ongoing team and individual work around culturally responsive practices, including examining our own biases and how they impact our expectations around the social, emotional, and behavioral functioning of children and adolescents. We encourage you and your team to check out the resources CASEL, which is the Collaborative for Academic, Social, and Emotional Learning, has available, which has some excellent recommendations for examining educational data through an equity lens. and using this data to inform the development and implementation of practices to support students and staff. Particularly their resource around SEL as a lever for equity, we found particularly helpful in our work. We know that the current pandemic has school teams concerned about higher levels of students being rated at risk this year for social, emotional, behavioral concerns on universal screeners. And given the current context, consider what can be built into Tier 1 instruction for all students, such as increasing engagement strategies, teaching additional coping skills to everyone, reinforcing pro-social behaviors, and building in more structured check-ins related to mood and current experiences to elevate our students' voices. If your team is struggling where to begin to decide how to meet the high number of needs, we encourage schools to consider engaging in resource mapping of the current school-based resources and community partnership resources you have available to support students social, emotionally, and behaviorally across the tiers. Consider using your school mental health team, your climate team, your Tier 1 team, or whatever team your school uses to engage in discussions around the social, emotional, and behavioral needs of all students to discuss how the current resources you mapped based on this mapping process can be used to increase and improve Tier 1 practice. During a time of increased social, emotional, and behavioral needs, it can be really difficult to figure out where to focus. Tier 1 practices is an excellent place to start. Screening data can provide a population check to see where our students are at and how they're responding to our universal or Tier 1 supports. Sharing this overall data, as well as data disaggregated by groups, such as race, gender, English learners, with stakeholders can be enormously helpful to get buy-in and input from important stakeholders, such as teachers, caregivers, community partners. If your team is struggling with where to begin to try to respond to meet the high level of student need, we suggest focusing on Tier 1 efforts to support both students and educators. And we suggest teaming with community partners to collaboratively deliver services to meet more intensive student needs. The CASEL SEL roadmap outlines clear action steps for moving forward. Check out this resource at casel.org/reopeningwithsel. The remainder of the modules in this series are listed on this slide. There are currently 7 modules in total. Module 2 is approximately 28 minutes long and describes prerequisites to screening in the form of action steps that school teams should consider prior to rolling out screening and administration, including assembling a school mental health team and who should be on that team, including roles and responsibilities, stakeholder buy-in and feedback, identifying screening objectives, using data before and during screening, identifying how data will be used, developing consent and assent procedures, and data sharing. Module 3 outlines screening approaches and is approximately 54 minutes in length. It goes into further detail about why screening is important and screening approaches that are available. It discusses those approaches in the context of school or district teams considering if the screening approaches are appropriate, technically adequate, and usable for their communities or populations. It discusses important considerations for evaluating these various screening approaches related to constructs being measured by the approach, informants, which refers to who completes the screener, and procedures involved in the approach. Module 4 describes a process to use in selecting a screener and is 14 minutes in length. It uses 3 questions to guide this process related to the technical adequacy of the screening tool. More specifically, is the screener evidence-based? Contextual appropriateness of the screener, which is, does the screener fit our specific needs? Usability and feasibility of the screener, which is how easily can the screener be implemented in our setting. Module 5 is 35 minutes long and discusses details of best practices around screening administration that schools and district teams should consider prior to and during administration, including informing students and families about screening procedures in advance, obtaining student parent consent, rolling out initial screening efforts gradually, planning logistics of screening administration, identifying resources for screening administration, a plan for responding to risk of harm to self and others reported by informants who are completing screening, and identifying resources and logistics needed for screening, such as staffing, the choice of informants, timing of administration, and frequency of administration. Module 6 is 23 minutes long and describes components to consider related to the screening data itself, to consider before administration. How is screening data going to be collected and then stored? How are the screening results going to be accessed after they are collected? How is data going to be kept private so that only team members who need to view the data will have access? How are data going to be shared with stakeholders, both at the aggregate level to show overall themes and on a more individual level to follow up related to strengths and needs for possible intervention, including considerations for responding to items involving assessment of risk, both for the system and for individual students. Module 7 is 1 hour, 4 minutes in length and describes processes for using SEB data to inform school-wide processes and individual student level intervention. Prerequisites to watching Module 7 include that the SEB screening measures and procedures have been determined. There's a school-wide team responsible for SEB screening, such as a school mental health team that meets regularly, and that this school-wide team has the power to make decisions regarding changes to universal instruction, as well as targeted and intensive intervention. This module reviews the purpose of screening and describes 2 processes teams can use to guide their use of SEB screening data. The first is a standardized targeted intervention protocol. It reviews using a resource map to identify existing school resources or interventions available, discusses entry criteria, including how we select students to receive each intervention, outcome measures and exit criteria to indicate whether the student has responded effectively to the intervention. It also discusses collaboration with community providers as a component of responding to needs identified based on screening data. The module also discusses using SEB in a problem-solving model. A module about district-level screening considerations is coming soon, and we will post when it becomes available. We encourage you to check out some of these resources that provide information on best practices around screening within a multi-tiered systems of support framework, including equity considerations. Thank you for joining to learn more about this series of modules on screening. We want to thank you for your time and attention to the behavioral health needs of students. At our website, you can sign up for our subscription list to get more information on best practices such as universal screening. We'd love to hear from you. Please reach out at birch.project@umb.edu with thoughts or questions. We hope you view the rest of our modules on universal screening as your team is building your capacity for engaging in screening. If you are interested in more consultation and coaching around these modules, please reach out to us at birch.project@umb.edu. Take care, and thank you for all of your work to support our students. Thank you.